Hi, I'm Conrad Fischer, and this is Routine Miracles. And there's nothing that makes me happier than to introduce my good friend and colleague, Dr. Scott Tenner. There's 3,900 cases of cervical cancer a year. There's 5,000 cases of chronic myelogenous leukemia. There's 12 of acute lymphocytic leukemia. How many cases a year are there of colon cancer?
About 130 to 140,000 cases per year.
And about how many of those people will die each year?
Almost a little more than a third. About 50,000 Americans die every year.
So 1,000 people a week die of colon cancer?
In the United States alone. A preventable cancer death. In
I'm sorry, what's that word you use?
A preventable cancer death.
How is it preventable?
Unlike most cancers that begin suddenly where it's cancer, such as lung cancer or breast cancer, colon cancer actually has a two-step process. So first the cells will just grow on top of each other and grow into something called a polyp, which is Greek for plant. And this small little growth will grow in the colon for many years undetected with no symptoms before it even begins to turn into cancer.
You know, that is the most amazing thing to me, that you have 10 years of opportunity
to find a polyp that's not a cancer.
To find a polyp.
Yeah.
The cancers come from polyps.
Yes, as the polyp enlarges.
The standard of care is that screening with colonoscopy is routinely about every 10 years, right?
Every 5 to 10 years.
Every
yes.
5 or 10 years. So that means literally you have years of opportunity to get in there.
It's a microcosm of the failure of a healthcare system because it's so preventable, and yet every year so many people develop the cancer, suffer from chemotherapy, surgery, and radiation, and unfortunately die.
The reason why I say it like that you have 5 to 10 years is not from the sense of procrastination.
In the New York City area, where we work very closely with the Department of Health, and we have widespread colorectal cancer screening, colon cancer deaths have dropped 20% in the last decade. People are alive today because they underwent this procedure. There is no week that goes by that we don't find large polyps or, in some cases, early cancers that we identify and prevent death.
Well, you see, Dr. Tenner, part of the reason that he's in this segment of the book is that Dr. Tenner is the leading national public health policy expert in gastroenterology. I think also what's important is for people to recognize the number of physicians that, unbeknownst to you, are fighting on your behalf.
Our congressmen, our senators are there to hear us, and the lobbyists from whether it be pharmaceutical companies or insurance companies, they're there. They're paid and they are there full time. They don't see enough physicians. They don't see people who are arguing for the side of healthcare, whether it be for patients or for our profession.
The greatest number of lives that I've experienced saving is participating in legislative action. And in my own case, it was the baby AIDS bill. So although Dr. Tenner is a doctor with a large clinical practice that sees patients, this is saying, yes, I spend part of my time doing colonoscopies and other endoscopic procedures, and the other part of the time, I'm the leading public health policy expert on gastroenterology in the United States, and I'm going to work for the health care of everybody on my own time on a voluntary basis is rather extraordinary. I think that that is really, in its own way, miraculous that people are doing that. What is your chance that you're going to have colon cancer? 6 to 8%.
Most important thing that we can do as gastroenterologists is to prevent colon cancer, which is still taking so many lives every year.
Dr. Tenner, is there anything else that you'd like to say?
Just make sure that if you're over the age of 50, you go out and get that colonoscopy, if not for yourself, for the people you love.